When I've talked with people about our health service, some people say, oh, but it's not really being privatised, is it? Our government doesn't want us to realise that full privatisation of the NHS is their goal. So I decided to think about the issue the other way round. If I was an evil genius trying to privatise a much loved public service, but in a way that the public wouldn't notice, how would I do it? So here is my plan for how to privatise the NHS on the sly in 5 simple steps. Step 1 is to introduce an internal market within the service. This means you break it up into little bits that have to act like independent companies. So instead of just cooperating together to meet patients' needs, health workers now have to buy and sell services from one another using a complicated system of internal contracts and fees. This is how you start to chip away at the public service ethos of the NHS. Now, this step was first called for by Margaret Thatcher in 1988, and it was put into place through the NHS and Community Care Act of 1990. Despite Labour's initial promise in 1997 to scrap the internal market, actually they extended it even further. So by now the health service is fragmented into little bits, but all of those bits are still publicly funded and publicly run. Step 2 is to start replacing some of them with bits that are publicly funded but privately run. This way you start to ease private companies into the system. This kind of outsourcing was introduced by the Tories in the 1990s, then extended by New Labour in 2006. Since then, there's been an increasing rollout of a policy called Any Qualified Provider, which was finally made into law in 2012 with the new Health and Social Care Act. Now, almost all services have to be put out to tender and can be snapped up by private firms. So when you need hospital treatment, you won't necessarily be going to your local publicly run hospital for much longer. It may soon be, for instance, a Virgin Healthcare hospital with an NHS label stuck on it. Step 3 in the privatisation process is to start charging for some services that are deemed to be non-essential. In our health service, working people are already expected to pay for prescriptions, dentists and opticians. As the privatisation of our NHS deepens, we might want to keep an eye out for more charges like these creeping in. This chips away further at the public service ethos of our NHS, ensuring that less and less is available for free. It's a process that can creep on gradually in a way that people don't notice. After all, once you start charging for medicines and eye care, why not for x-rays and ambulances, as happens in some other countries? After a while like this, you get to a point where only very basic care is available for free. Then you effectively have a two-tier system, where people that can afford to pay get treated promptly in the private sector, while less well-off people, or those with more complicated needs, have to join a long waiting list to use the few remaining public health services. Step 4 is to withdraw free services entirely from groups that are politically unpopular. Immigrants are often the easiest people to pick on. We saw the first signs of this in the UK recently with the push to start charging foreign nationals for NHS care. Once you've withdrawn free care from one group, it's easy to go further. Perhaps you make it difficult for unemployed people to get proper healthcare on the basis that they're not paying for it through tax. For example, Canada's public health system provides full care for those in paid work, but more limited services for unemployed people. With this step, you're really starting to cement the idea that healthcare isn't a basic right that we provide collectively for our whole society. It's something that you buy for yourself by paying tax and social security. And if anybody is unable to pay their way, well, hard luck. This allows you to move smoothly to the final step in the covert privatisation process. Step 5. Remove free care altogether. By now, there's so little health service left that it's easy to let the last bits wither away. Funding gets cut every year until the very last free health services are forced to shut up shop. This would mark the end of our National Health Service, our nation's greatest invention that has kept us healthy since 1948. It would return our country to the health system we had before World War II, where most people couldn't afford the doctor, so when they got ill, they stayed ill. So that's my 5-step evil genius's guide to privatising a much-loved public service. Having thought through all that, it's clear to me that the NHS is already being privatised, and it's something I'm going to do everything in my power to fight against. If the Green Party were in government, we would bring the NHS back into public hands and make sure that all public funding goes towards patient care rather than shareholder profits. We do believe in changing health services for the better, but you don't need to sell off public assets to profit-making companies in order to modernise the way that you work. We would also address the causes of a lot of ill health. At the moment, many people are stressed due to working ridiculously long hours, while others are depressed because they can't find a job at all. The Green Party would make big changes to how our economy works, giving us a more equal society and a better work-life balance. We would make it easier for people to get regular exercise by walking or cycling to where they need to go. And our support for local shops would help to make sure that genuinely healthy food is available and affordable for everybody. These changes, among others, would make us into a happier and healthier society. You might be wondering how the Green Party would pay for a better public health service. We're often told that the only alternative to austerity cuts and privatisation is to increase the deficit and get the nation even deeper into debt every year. But there is another way to pay for better public services. It's called tax. We believe that a decent health service is worth paying for, and we can afford it if we increase taxes for wealthy people and for corporations. So that's the core of the Green Party's vision for the NHS. Make it a properly funded public service for the common good.